If you're over 60, this message is for you. One small mistake before a blood test could quietly change your results. Not because something is wrong with your body, but because no one ever warned you what not to do. Every single day, millions of seniors just like you get blood tests. You're checking your blood sugar, your cholesterol, liver function, kidneys, vitamins, and important heart markers. These tests are meant to protect you, to guide your doctor, and to give you much-needed peace of mind. But here's an uncomfortable truth. Many blood test results in older adults are misleading. And it's not due to disease. It's not even due to age alone. It's because of simple, avoidable mistakes made before the needle ever touches your arm. And the most concerning part? Most seniors are never told about them. Doctors see this happen all the time. A perfectly healthy senior is suddenly told their numbers look off. Medications get adjusted. Worries start to pile up. Sleep is lost. Then, later, sometimes much later, someone realizes the test was skewed. It was skewed by food, by supplements, by dehydration, by timing, even by stress. None of these mean you are unhealthy. They just mean the test didn't reflect your true baseline health. You see, as we age, our bodies become more sensitive. Our blood sugar responds faster to what we eat. Our hydration levels can change much quicker, and medications can stay in our system longer. This means even one cup of coffee, one late-night snack, or one missed glass of water can shift your lab numbers just enough to raise a red flag. And that's where the problem really begins. Many seniors prepare for their blood tests the exact same way they did when they were 40. But aging changes the rules. What worked for you decades ago might actually be working against you today. Some of these mistakes are obvious, but others are surprisingly subtle. A few are so common that doctors almost expect to see them. For example, have you ever fasted for too long, thinking longer is better? Or have you taken your daily vitamins on the morning of the test, assuming they don't matter? Some people drink a ton of extra water right before walking into the lab, while others barely drink any at all. Each one of these actions, no matter how small they seem, can quietly distort your results. And the scariest part? Abnormal numbers often lead to a cascade of follow-up tests, unnecessary worry, and sometimes even treatments that may not have been needed if the first test had just been done correctly. Now, this isn't about blaming anyone. This is about missing information. We all know medical offices are busy. Instructions can be rushed, and seniors are often expected to just know how to prepare for these important tests. But no one ever really sat you down and explained the real mistakes that seniors make before a blood test, the kind that doctors talk about quietly among themselves. In this video, you are going to learn what those mistakes are. We'll go through them plainly, calmly, and without any fear-mongering. You will understand exactly why your results can change, what to avoid, and how to walk into your next blood test feeling confident that the numbers reflect you, and not just a simple preparation error. So let's get into it. And coming up next, we're going to start with the single most common mistake that seniors make before a blood test. It seems completely harmless. It almost seems sensible, but it quietly throws off more lab results than almost anything else. If you're over 60, getting a blood test can feel a little stressful. You want the results to be accurate, right? But what if I told you that some of the things you do to prepare might actually be working against you? Let's talk about the 10 hidden mistakes that can mess with your blood test results, not in complicated medical jargon, but in simple, real-life terms. First up, fasting for too long. Many people think the longer you fast, the better the result. But that's not true. Fasting for more than 12 hours can actually signal stress to your body. For older adults, this can cause a slight spike in blood sugar and cholesterol levels. For most tests, A simple 8 to 12-hour fast is all you need. More isn't better. Mistake number 2 is drinking coffee, tea, or even flavored water while you're fasting. You might think, it's just black coffee. What's the harm? Well, even without sugar, caffeine can stimulate stress hormones, which can affect your blood sugar, triglycerides, and cortisol levels. Even artificial sweeteners can mess with your insulin response. The only truly safe drink before a fasting blood test is plain water. Which brings us to mistake number 3, skipping water altogether. Some people avoid drinking anything to keep their system empty. This is a big mistake. It quickly leads to dehydration, which thickens your blood. This can make it seem like your kidney function is worse than it is, and it can falsely increase your red blood cell count and calcium levels. So, remember to take small, steady sips of water to stay hydrated. Next, mistake number 4, taking your morning vitamins and supplements. This one is huge. Many supplements directly interfere with lab results. For example, biotin, which is common in hair and nail supplements, can throw off your thyroid tests. High doses of vitamin C can affect glucose readings, and minerals like calcium, magnesium, and iron can alter your results. Unless your doctor specifically tells you to take them, it's best to skip your supplements on the morning of your test. Mistake number 5 is exercising before you go to the lab. Even a brisk walk or climbing a few flights of stairs can temporarily change your results. Exercise can increase muscle enzymes, raise blood sugar, and even elevate inflammation markers. On test day, your body should be at rest. Save the workout for after your blood draw. Now, for mistake number 6, a bad night's sleep. We often underestimate how much one restless night can impact our health. Poor sleep affects your hormones, which can lead to higher blood sugar, elevated blood pressure markers, and increased inflammation. Before a test, try to have a calm, restful evening and get a good night's sleep. Mistake number 7 is having a drink the day before. Even one glass of wine or beer can affect your liver enzymes, triglycerides, and blood sugar for up to 24 hours. And as we get older, it can take our bodies longer to process alcohol. To be safe, just avoid alcohol completely the day before your blood work. Mistake number 8 is stress and rushing. Feeling anxious or rushing to get to your appointment can spike your cortisol and adrenaline. This can temporarily change your glucose levels, blood pressure markers, and even your white blood cell count. Try to leave early, and once you get to the lab, sit down and relax for a few minutes before they call your name. It helps your body stabilize. Mistake number 9 is not being clear about your medications. Some common medicines have a bigger impact on lab results than you might think. Diuretics can affect your electrolytes, pain relievers can influence kidney markers, and heart medications can alter cholesterol panels. Always tell the person drawing your blood exactly what medications you've taken and when you took them. Finally, mistake number 10, testing at different times of the day. Your body has a natural daily rhythm, and many blood markers fluctuate throughout the day. If you test in the morning one time and in the afternoon the next, it's hard for your doctor to see a true trend. Sticking to a consistent time, usually in the morning, gives the most reliable picture of your health. If you've made some of these mistakes, don't worry. It doesn't mean something is wrong with you. It just means the test might not have shown your true health baseline. Let's talk about what to do before your next blood test. No complicated rules, no strict routines. Just simple, realistic habits that help your blood work show your true health. These tips are safe, practical, and especially important after you turn 60. First, create a test-ready routine starting 48 hours before your appointment. Accuracy doesn't begin on the morning of the test, it starts 2 days earlier. What does that mean? First, eat normally, not perfectly. Don't suddenly start a super healthy diet, or restrict your food. And please, avoid big feasts or trying unusual dishes. Just stick to your regular meals. Sudden changes can confuse your body's chemistry, and your doctor wants to see your normal baseline, not a temporary blip. Next, avoid alcohol completely for those 2 days. Alcohol can affect your liver enzymes, blood sugar, and fat levels. And after 60, the body processes alcohol more slowly. Skipping it for just 2 days makes your results much more reliable. Finally, keep your hydration steady. Don't chug a gallon of water, but don't avoid it either. Just sip small glasses throughout the day. Your urine should be a pale yellow, not crystal clear, and not dark. The second habit is preparing your supplements and medications properly. This is one of the most overlooked steps. Start by making a written list of every single thing you take. Write down all your vitamins, herbal products, prescription medications, even powders you mix into drinks. Bring this list with you to the lab. On the morning of your test, skip any non-essential supplements unless your doctor has told you otherwise. This includes things like biotin, calcium, iron, and vitamin C. You can take them right after your test is done. Most importantly, take your prescribed medications exactly as directed. Some you should take, some you might need to delay. Never guess. Always follow your doctor's specific instructions. Habit number 3 is to fast the right way, not the hard way. Fasting mistakes are a huge cause of false alarms on lab reports. For most tests, you only need to stop eating 8 to 12 hours beforehand. Fasting for longer can actually stress your body and skew the results. So, don't fast all night and then half the next day. During your fast, drink only plain water. That means no lemon, no sweeteners, no tea, and no coffee. Water helps keep your veins full, making the blood draw easier, and it keeps your results accurate. And please, avoid that just one bite temptation. Even a tiny snack can raise your blood sugar and triglycerides. If you do eat by accident, just be honest and tell the lab staff. Next, protect your sleep and find your calm the night before. Sleep has a powerful effect on your lab values, especially after 60. Try to eat a lighter dinner. Heavy meals can disrupt your sleep and digestion. Stick to simple, familiar foods. Then, turn off all your screens, your phone, your tablet, your TV, at least 1 hour before bed. The blue light messes with your sleep hormones. Instead, try some slow breathing or gentle stretching. Avoid watching upsetting news or having stressful conversations. One calm night can make a real difference in your results. Habit 5. Keep your test morning slow and gentle. How you move really matters. Avoid any exercise on the morning of your test. That means no brisk walking, no heavy lifting, and no running up and down the stairs. Physical activity can raise muscle enzymes and even your blood sugar. Also, dress warmly and comfortably. Being cold can make your veins constrict, which makes the blood draw more difficult. A warm sweater can be your best friend. When you get to the lab, arrive a little early and just sit quietly for 5 to 10 minutes before they call your name. Let your heart rate settle. Remember, calm equals clarity. Habit 6 is all about consistency. Your doctor is often more interested in the trends over time than in a single number. So, try to schedule your tests for the same time of day each time. Morning is usually best for most tests, but the key is consistency. Also, if it's possible, use the same lab for all your tests. Different labs can have slightly different reference ranges, and sticking to one lab helps your doctor track your trends more accurately. Habit 7. Communicate honestly, without fear. Your job isn't to get a perfect score on your blood test. Your job is to provide an accurate picture of your health. So, Tell the lab staff if you slept poorly the night before. Tell them if you accidentally took a supplement. Tell them if you were feeling really stressed out. This context is incredibly valuable. Doctors can adjust how they interpret your results based on this information. Honesty helps them help you. Habit 8 is to review your results calmly, not emotionally. The numbers on that report are just information. They're not a judgment of who you are. One abnormal value does not define your health. Trends over several tests matter much more than a single reading. And knowing you prepared properly can help you avoid unnecessary panic. Good preparation helps your doctor give you better guidance. Habit 9. Build these habits into your everyday life. These aren't just test-only behaviors. They are the foundations of good health. Steady hydration, consistent sleep, moderate movement, and balanced eating support your well-being every single day. When you live this way, your blood tests become a simple confirmation of your health, not a source of scary surprises. And finally, habit number 10. Remember that aging changes the rules. What worked for your body at 40 might not work the same way at 70. This isn't a sign of weakness. It's just biology. Being informed and prepared gives you a sense of control over your health journey. If there's only one thing you remember from this video, let it be this. Blood tests are tools, not verdicts. After age 60, your body is still communicating clearly. It just needs the right conditions to speak accurately. So many seniors blame themselves when results look abnormal. They think aging has finally caught up, or they fear something serious is developing. But very often, the issue isn't your health, it's the preparation. A rushed morning, too little water, a forgotten supplement, a night of poor sleep, or even just unnecessary stress. None of these things define you, and they certainly don't mean it's too late. The good news is, every mistake we've talked about is fixable. And improvement doesn't require extreme changes. You don't need to become perfect or follow strict punishing routines. All you need is awareness and consistency. And that is incredibly empowering. When seniors prepare for their blood tests properly, doctors see much clearer patterns. Fewer false alarms appear. Follow-up tests become less frequent, and the conversations you have with your healthcare provider become calmer and more productive. Instead of reacting to a set of confusing numbers, you begin responding to meaningful information. That shift truly matters. It reduces worry. It protects the trust between you and your doctor. And it helps you make decisions based on reality, not on noise. And here's something many seniors really need to hear. If you've had confusing or concerning blood tests in the past, it doesn't mean permanent damage was done. It doesn't mean opportunities were missed. It simply means you now have better information to use going forward. Today is your reset point. From this moment on, you know how to prepare. You know what matters, and you know what to avoid. That knowledge gives you back control. You see, aging doesn't mean losing control. It just means learning a new set of rules and using them wisely. Your body isn't failing you, it's adapting. And when you support it properly, it responds beautifully. You deserve clarity. You deserve calm explanations from your doctor. You deserve health care that feels supportive, not alarming. So, the next time you schedule blood work, just take a deep breath. Plan ahead a little. Follow the gentle habits we discussed. Walk into that lab feeling calm and confident, not worried and rushed. And when you see your results, remember this. The numbers are just snapshots, not the whole story. Trends over time matter much more than a single value. Context matters far more than fear. If something does need attention, you and your doctor will address it together, step by step, without panic. And if the results look better than you expected, allow yourself to feel encouraged. That feeling matters too. If this video helped you feel more informed and less anxious, then that's a huge win. If it helped you understand your own body a little better, that is wonderful progress. Please consider sharing this information with someone over 60 who might be confused or worried about their blood tests. So many seniors suffer unnecessary stress simply because no one ever explained these basics to them. Knowledge shared is health protected. Take care of yourself. Be patient with your body. And always remember, it is never too late to support your health with calm, informed choices. Thank you for spending this time with us. We look forward to helping you stay confident, informed, and empowered in every stage of your life. See you in the next video.